Hello, this is Shehab Anwer. On behalf of our research team at University Heart Center Zurich, I'll speak today about circumferential deformation in diagnosis and risk assessment of patients with left ventricular non-compaction. In this study, we compared 45 patients with non-compaction cardiomyopathy to 45 patients with hypertrabeculated left ventricle and 45 healthy age and gender matched controls, where we performed a comprehensive strain analysis to understand the longitudinal and circumferential strain as well as regional rotation and LV twist. And we updated their clinical follow-up records for a median of 7.5 years for the occurrence of cardiovascular mortality, ventricular arrhythmias, progression of heart failure, or cerebrovascular accidents. The global circumferential strain was significantly different between the three groups, and this was reflected on the regional basal and apical peak circumferential strain between the three groups as well. For the regional basal and apical peak systolic rotation, it was not different between the controls and the left ventricular hypertrabeculation group, but the non-compaction group was significantly different between those two other groups. And this is reflected on the LV twist, which is the difference between the apical and basal peak systolic rotation. Then we performed a ROC analysis to identify which parameters can differentiate the three study groups. And the global circumferential strain identified control patients who had a cutoff more than or equal to 22.3. Then the apical peak circumferential strain with a cutoff value of 18.4 differentiated hypertrabeculated from the non-compaction cardiomyopathy who had APCS less than 18.4. We performed univariate analysis in order to identify which parameters are significantly associated with outcomes. And then using a tri-variable analysis to identify which parameter independent of ejection fraction and non-compacted to compacted layer ratio had association with outcomes, we found out that the global circumferential strain was associated with 11-fold increase in cardiovascular events in comparison to the longitudinal strain, which is only associated with 2-fold increase. And other parameters such as the apical peak circumferential strain was associated with 15-fold increase in risk of cardiovascular events, or LV twist that is associated with 11-fold increase in risk of cardiovascular event. In the end, we would like to conclude that a diagnostic algorithm with global circumferential strain and apical peak circumferential strain with a threshold value of 18.4% differentiate non-compaction from hypertrabeculated left ventricle and controls with very high sensitivity and specificity, independent of additional echocardiographic or clinical information. And circumferential strain derived parameters exhibit a very strong association with outcomes independent of ejection fraction and non-compacted to compacted layers ratio. I'd like to thank you so much for watching our video and wish you enjoy SwissCardio 2020.